reverse that. I believe so, yes.
So bring one up with us. Check 1, 2.
Good afternoon, everyone. My name is
I
Angelo
look at
Valente.
everybody
I'm the
differently.
Executive Director of the Partnership for a Drug-Free New Jersey, and I'll be moderating today's forum. Thank you for coming and joining us today for a conversation to knock out opiate abuse here in Atlantic County. Today's event is hosted by the Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey. Today is the first of 17 town hall meetings that will be held in communities throughout our state to address the opiate epidemic and develop solutions to that epidemic. New Jersey is in the midst of an opiate epidemic. There's not a day that goes by without hearing or seeing a story in a neighborhood or in the media about the impact of the misuse of prescription medication, heroin abuse, the countless overdoses impacting all of our communities, and so many families dealing with the day-to-day challenges of this disease. Atlantic County is not immune. No family or community is immune. And today we gather together to learn how we can address this epidemic, how we can prevent more New Jersey residents from becoming addicted, how we can reduce stigma, how we can help those who are addicted, and how we can support those that are in recovery. The Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey is pleased to bring this conversation here to Atlantic County. Today, along with our partners of this initiative, join together Atlantic County, the Atlantic County Opiate Task Force, Stockton University, and the Stockton University Campus Police. We thank you all for joining us for this important conversation today, and it's now my pleasure to introduce our host, Eileen Conran Folks from Stockton University.
Good afternoon. What a joy it is to see so many people engaged in this conversation. On behalf of President Harvey Kesselman and Provost Laurie Vermeulen, I would like to welcome you to Stockton University for the first town hall that we're having to knock out opioid abuse. Today's event was coordinated by a team of really dedicated faculty, students, staff, along with our wonderful partners, some of whom are up here, some of whom are in the audience, Horizon, Partnerships for Drug-Free New Jersey, and the Community Initiative Join Together Atlantic County. As Angelo said, we did want to take a moment and thank Chief Cindy Parker for rallying up the troops, the production services, the event services, and all the folks who are making this happen. As Angelo also said, opioid addiction does not discriminate. It affects everyone, every race, every gender, and class. Programs like this set out to change that perception and to engage with our students, healthcare partners, local police, and community partners to explore ways in which we might reinforce our efforts to help combat against this devastation that the opioid crisis has brought to our neighborhoods, schools, and our families. We appreciate your participation today because we know that we all need to play a role in order to make a difference. Thank you again. Our students will be joining us periodically, so thank you for indulging them. They're on a different schedule than us, but I turn it over to Angela. Thank you.
Thank you so much, Dr. Cochran. We know there are no easy answers. We also know it's necessary for all of us to work together as a community and try to come up with ways to eradicate the epidemic and to change the public attitude towards addiction and to change. We are here today to start that change. Ultimately, our goal is to reduce the epidemic levels that we're seeing in the state of New Jersey. And I want to thank all of you for joining the conversation here to begin that process. It's now my pleasure to introduce our sponsor for today's town hall. From Horizon Blue Cross Blue Shield of New Jersey, Mary Ann Christopher, Vice President of Clinical Operations and Transformation. Mary Ann?
Thank you, Angelo, and good afternoon, everyone. It's an honor and pleasure for me to be here with you today on behalf of Horizon Blue Cross Blue Shield of New Jersey to help kick off this extraordinarily important event. As the state's largest and oldest health insurer, Horizon Blue Cross Blue Shield of New Jersey is dedicated to improving the lives of all the folks in New Jersey. That is why we are proud to sponsor today's town hall meeting and others that will happen throughout the state. This town hall series is being funded through the arm of our company, the Horizon Foundation for New Jersey, which is our philanthropic arm. Since its inception in 2004, the Horizon Foundation has funded more than 1,300 grants to nonprofit community-based organizations for a total of $48 million, all of which have been aimed at improving the public health and improving safety of the residents of New Jersey. This grant that we are funding with Angelo and the Partnership for Drug-Free New Jersey is no less important than all of the other programs that we have sponsored. In fact, it's significantly important. As Angelo said, high rates of opioid addiction have claimed an estimated 5,000 lives of New Jerseyans over the past several years. Fentanyl use is up 50 times more powerful than heroin. It's killing our neighbors and family members every day. That's why we're supporting this launch of Knockout Opioid Abuse New Jersey. We're committed to collaborating with Angelo and thought leaders like those who join us on the panel today. And all of you, we want to know what you're thinking, what your hopes, your dreams, your concerns are relative to this epidemic. We're going to build on the programs that we have historically supported at Horizon, where we have red flags in our systems when we see prescriptions that are prescribed that do not seem appropriate. We reach out to our members when they're patients. We reach out to physicians and pharmacists to try to prevent opioid misuse at the very beginning. We arm doctors and nurses with the information they need to make sure that you get the health care that you need. And we educate our members, folks like you, to ask the right questions at moment of treatment so that you can really make a difference in how your own health care is delivered. So today we're looking forward to hearing your voices and to making sure your voices really drive the solutions for turning this around in the state of New Jersey and beyond. Again, it's a privilege and an honor for us to be here with you today. Thank you.
Thank you, Marianne, for your leadership and the leadership of Horizon Blue Cross Blue Shield of New Jersey on this issue. Today is as much about hearing from our expert panelists, who will be introducing in a few moments, as it is among hearing from your voices, sharing your ideas, your suggestions. The questions you have and the recommendations you have will be important in developing solutions to this epidemic. But at this point in time, I'd like to introduce our panel, our expert panel for today. Our panel begins with the Honorable Damon Tyner, who was sworn in as Atlantic County Prosecutor on March 15, 2017, after being nominated by the Governor of the State of New Jersey with the advice and consent of the State Senate. He previously served as a judge of the Superior Court of New Jersey, having been appointed by the Governor in June 2014. Our next panelist is Assemblyman Vince Mazzio, representing the 2nd Legislative District. Assemblyman Mazzio was elected to the General Assembly in 2013 and won re-election in 2015. Assemblyman is the Vice Chair of the Assembly on Tourism, Gaming, and Arts Committee and on a Regulated Professions Committee. Next, we have, speaking about substance misuse prevention, Lori Smith. Lori is the Community Initiatives Coordinator for the Atlantic Prevention Resources and the coordinator of Join Together Atlantic County. We also have with us today Alton Robinson, who will lead us. He's a lead certified peer recovery specialist for CARES New Jersey. I'd like to begin by asking the prosecutor, can you give us a snapshot of the opiate epidemic here in Atlantic County from a law enforcement perspective?
Well, thank you, Angelo, and I want to thank Join Together Atlantic County, and more importantly, all of you have joined us here today because you recognize how important this issue is and how important this epidemic is to our community. It is literally wiping out folks of all ages, all races, all religions. It's wiping out families. It's destroying families. I bring a unique perspective because, as Angelo mentioned, I did serve as a judge prior to just recently becoming the Atlantic County prosecutor. And as a judge, I started out as an administrative law judge in 2012. To give you a perspective of what an administrative law judge, they hear appeals from every state agency in the state of New Jersey. You might say, well, how does heroin misuse or opiate misuse come into play with respect to an administrative law judge? Well, one of the first hearings I had was a civil service disciplinary hearing. It involved a fireman from a local community who had gotten injured on the job, and he had been prescribed opiates. He started abusing them, and he became a heroin addict. One might say, well, we know a lot of heroin addicts. How does that affect the general public safety? Well, when they're driving a hook and ladder and reporting to a fire and trying to save all of us, it's a problem. He's not only affecting himself then, he's affecting all of us and our livelihood and our safety. So the individual was trying to maintain their job and maintain their employment, but he wanted to do that without seeking the proper care and the proper treatment. He said he was cold turkey, he was fine, he was ready to go. Unfortunately, he did not keep his job for him, for his family. Fortunately, he ultimately did get the help that he needed, and he's doing quite well to this day. But it took him losing his livelihood to finally realize that he had to address his problem and in a correct manner. I then moved on to the Superior Court, and I served in both the Family Division and the Criminal Division. You can imagine, I was assigned to Children in Court, which involves the Division of Child Protection and Permanency. So you can imagine the cases that I would have. I would also do child custody cases. Many times we had a saying in my court that grandparents step up when parents fall down. And there were a lot of parents that fell down that came before me. And we had to transfer custody to grandparents who are now raising their children. And once again, the first time it really started to hit me that there was an issue that was one that we couldn't address with the same old approaches was I had a woman, she had lost custody of her children, and she came into court seeking to regain custody. Her husband, because they were still married, came in and said, look, she can visit our children anywhere she wants, but she can't drive them, she can't be alone with them, and it hurts me, but, I'll let her see them, but our children really don't want to see her in the condition that she's in. We just want her to get help. We tried very hard to get her the help that she needed. And this was the first of 19 instances where I scheduled someone for court 3, 4, maybe 6 weeks out. And before they could make it back, I read their obituary in the paper. True story. I kept count. And I kept count with her. But in her case, her husband's words were almost prophetic because about 2 or 3 weeks later, she got into a car accident right here in Galloway Township. She was driving with 2 others, and ultimately it was determined that she was under the influence of drugs, and she ran a stop sign, and she, got hit by a very large truck, and she died. The other 2 people in her car did not. But when I saw that she was supposed to be in court, she had showed up to show you the sadness of it all. She had rejected every kind of treatment in the past, but she had finally showed up for her task evaluation, we call that in the courts, where folks show up, they get a substance abuse evaluation to determine how bad their problem is or what problem exists and to determine the course of treatment. The week before she had finally showed up, she had rejected all attempts before. She had showed up, she got evaluated, and she was waiting for a bed. And unfortunately, she perished before she could get the proper treatment. So then moving on to the criminal division where I served for a little bit over a year. If it hadn't become abundantly clear by then, Angelo, it definitely became abundantly clear while I was in the criminal division. The most popular plea bargain that I took day in and day out was third-degree possession of heroin. But then you look at the other crimes that were prosecuted, whether it was shoplifting, whether it was credit card fraud, whether it was various crimes associated with cheating in the casinos, whether it was burglary, it all came back to the abuse of heroin and the misuse of opiates. There was a saying within the courthouse that Atlantic County doesn't have a crime problem. We have a drug problem. And if we are able to successfully treat the drug problem, then perhaps the level of crime will go down. It's actually one of the reasons that led me to the position that I'm in now, because I just felt helpless day in and day out taking these pleas. Some people would get treatment, some people wouldn't, most people wouldn't. And they would just say, look, give me my sentence, I'm getting out of here, I'm going to get high again. We have folks that would come to court under the influence of drugs. You can get heroin within 5 minutes of any courthouse in this state. It's a reality. And as a result of that, when the opportunity presented itself to me to become the Atlantic County prosecutor to fight this and many other problems, it was appealing because I could finally do something on the front end. And I'm not talking about just arresting folks. We cannot arrest ourselves out of this problem, in my opinion. Maybe some others disagree. But we've tried that before, too many times and for too many years, and we have too many lives to show for it that it didn't work. So I'm here, I shudder at being called an expert, but what I am an expert is listening, and I hope to listen to all of you about the ideas and concepts that you have that maybe we could pursue to help this problem, to help our neighbors, to help our family members, to help our friends, because we need it. We are in a dire position right now, and it is my hope, my sincere hope, that we will be able to use progressive measures to get folks the treatment that they need, and that ultimately we will be able to make a dent in this epidemic that we're facing. So thank you very much.
Thank you, Prosecutor. Before I introduce our next expert to provide some information about what's happening at the state legislature, I just want to introduce a gentleman who's in the audience who is a fellow prosecutor from Ocean County, Joe Coronado. Prosecutor Coronado has really been a trailblazer in helping individuals that are addicted and being able to provide complete services in Ocean County. So we appreciate his attendance today, and I know Ocean County will be hosting one soon. Thank you. Assemblyman Mazzio, what's being done in the state legislature to address the issue of opiate abuse?
Not enough. I want to thank you for allowing me to come here, and I just have to echo Prosecutor Tyner here that if you told me 3 or 4 years ago that I was going to be an expert for the opiate and heroin addiction in Atlantic County, I would say, I didn't know anything about it. And how I got involved with it, back in 2015 in September, I had a town hall meeting because there was a lot of people coming to my legislative office talking about addiction, heroin and opiate addiction. And so I wanted to learn more about it. And when I had a town hall meeting at Atlantic Community College in 2015 of September, there was about 150 people there. And I see a person here who gave a testimonial. There was 4 testimonials, and I hope you don't mind me saying this. It was 2 days after her daughter died that she came to this town hall meeting. That tells a lot, and I tell you, it gives a lot of courage to this woman that was there, that she knew that she had to make a difference after her daughter died. And we know all the statistics out there. I was reading from 1999 to 2015, about 183,000 Americans have died from opiate-related deaths. There was 1,600 heroin overdose in 2015 that died. 4 out of 5 new new users of heroin was a result of mismanaging pain killers who they started to use heroin because of opiate. We all know these stories. So as a legislator and as just a human being, you know that there's a problem, and you know that you have to do something. And there's a lot of moving pieces in this puzzle that this overdose and the opiate and heroin addictions. And one of the areas I have been working on legislatively is education, treatment, and I kind of switched wheels because the overdose were so dramatic or happening, it seemed, every day, and it is happening every day, that I switched gears and took initiative of doing Narcan and trying to mandate it where I could legislatively. I have a bill out there that mandates it in every high school. It's moving through the assembly slow. I wish it was moving faster. But you know, we have EpiPens, we have defibrillators. So common sense would say, you know, with this epidemic, why don't we put it in the schools, in the high schools? And the other part of it that came to our attention from the EMS first responder, and a gentleman sitting in the audience here today, he works in the Buena Vista Rescue Squad. He would go on a call, and there would somebody be an overdose, and he would have to hit them with the Narcan or the Noxolin. And he could hit them once, and a monitor today was saying about fentanyl. You know, they're cutting it with fentanyl now, so it's so strong, you have to hit them again, and then maybe again to bring them back. And the problem with the first responder is they have a directive from the county and the state that they have to call the medical doctor to do a second or third hit, which could take 5 minutes, could take 10 minutes, could take 3 minutes. Whatever time it is, that person could die or have brain damage or whatever. So I'm trying to get this legislation which passed through the Health and Human Services, and we had testimonial from 4 different individuals, including Mr. Amato, who came up. And, you know, it's just, these directives were given, you know, whenever. But the epidemic, the state can't catch up with the epidemic. And, you know, we're going to try to get this passed through, and working with a pharmaceutical company that's going to provide free Narcan to the high schools in New Jersey for the first dosage. They're already doing it in Pennsylvania. And thank God, you know, the approval rating for Governor Christie is 17, 18%. But I have to say, my approval rating for him to at least focus on the last year of his term on this opiate and heroin addiction, I'll give him kudos for that. And he's you know, he's working on he's doing it with resources, and he's going to do it with policy. And some of the things are the 5-day prescription, where you have to go to your doctor and get a prescription after 5 days if you have the painkillers. A lot of people balked at that, but in the bill, just to be clarified, there's people have chronic diseases and things of that nature. I think that they're cleared, but you know, we have to. The epidemic's so big, we have to change it around and do a 180. And the other part of it is, and people always complain about the health insurance, where we mandate 6 months that they get coverage with certain, you know, people under certain necessity. So the governor is working on this, and I think that we have to all work together to make a difference of changing this epidemic around. And you know, if you had a magic wand, what you can do with this, I really don't think there is. But you know, you could tell the drug companies not to be so aggressive with their marketing, physicians to be careful, and I think the stigmatism out there as far as people who are, if you look at it like in layman's term, maybe it's kind of similar to the common cold. They don't ask to be sick, or they don't ask to be be this addict. It's something that we have to address, and I think that a lot of people aren't educated enough on this disease and this addiction that we need to reach out and make sure everybody's educated in the treatment, and I'll do my part as a legislator. Thank you.
Thank you, Assemblyman. And the Assemblyman was talking about educating the public. Another part of the bill that the Assemblyman supported recently that the governor signed now requires that prior to prescribing an opiate, a conversation must take place between a prescriber and a patient or the parents of a patient 18 and under, and that conversation has to include non-opiate alternatives that might be available. So that's another piece of legislation that the Assemblyman was very supportive of, and we thank him for that support. Speaking about prevention, our next speaker, Lori, is going to speak about how we're dealing in prevention and addressing the epidemic.
Thank you. Basically, for every dollar spent in prevention, it saves $4 to $5 in treatment. And we're talking about prevention beginning with youth. That's the main focus of our coalition. We have a federal drug-free communities grant, as well as a statewide regional coalition grant. And we started out, we have to target underage drinking and marijuana use, and we also targeting prescription drugs. With the recent epidemic, we've had to, of course, expand our information and our reach into the community. A lot of the programs that our fiscal agency does, Atlantic Prevention Resources, are character education programs, strengthening families, working in the schools with youth directly, and bringing parents out into the schools and working with them. All of those programs do include drug and alcohol prevention. What the coalition is focusing on is more of a community-wide reach, working on legislation, working with different people you never would have thought that we as a prevention coalition would have to work with. And I'll give you an example. I'm working with realtors. And a lot of people would think, well, what would you do with a realtor? And we're working with them on changing their organizational policies to include when they have an open house, instead of just removing valuables and removing cash in the house, they have to remove the prescription drugs. And if you think about that, if a person's in the house and they're looking through and they happen to look in the medicine cabinet and they take out those medications, and working with funeral homes, so as soon as there's a death in the family and they give the packet of information, they also give information on removing the prescription drugs immediately from the house. And especially when it goes into the obituary that a person has passed away from cancer or some other disease, it's a cue to know that there's probably a lot of drugs in that house, and we need to get rid of it quickly. What we've done with our coalition, we have actually, there's 15 permanent drop boxes located here in Atlantic County, and they're located mostly in police departments. Buena Vista has the only one located in a town hall, and then we have 14 other ones in local police departments. We only have a couple of police departments that do not have them. And this is a place where anybody can go and drop off medications. And a lot of it is just that education piece. We're working with pharmacies throughout the county, and pretty much almost every pharmacy, we've been giving them information to give out to their patients. So when they are prescribed an opiate drug, they actually can have that information on where the drop boxes are located and about the aspect of addiction that comes with it. We held in Atlantic County, and we were the most southern Do No Harm Symposium for physicians. And with Atlantic Care, we had brought out over 80 physicians for a symposium out in Atlantic City one day. And we had over 46 primary care providers. And just the idea, again, of getting that information that, it is an opiate. I know, as many of you know, when our children have painkillers prescribed to them, whether it's for a sports injury, or how many of our kids have wisdom teeth removed, and they're given these opiates, and the parents, we kind of just assume, since it's coming from a physician, that it's safe for our kids to take them. So we're working on that aspect as well. Even then, and actually up at our table, we have locking medicine cabinets. Here at Stockton, one of the things we partner with them was their students do not have a way of locking up things unless they brought in a safe into their dorm room. So we're providing locking medicine cabinets in those dorm rooms for the students to be able to lock up medications that they may have. And they can call over to housing and actually get one. Part of Chris Christie's mandate was to have recovery housing among state colleges by the year 2018. We've been part of that organizing of it here in Stockton. I believe they're actually going to be prepared to open up their recovery housing this coming fall, so a year ahead of the state mandate. We're doing a lot of other things too. Working with our opiate task force, we actually went up and visited the Ocean County task force and some of your health department members a few years ago and talked to them about some of the things that we're doing. So most recently, and this was something that we have never even kind of, addressed it before, was working with the police departments and the schools to address addiction. I think that is right now one of the biggest issues we're facing with this epidemic, that people are not inclined to go and tell someone that they have this addiction and this disease in their family and to seek help. And unfortunately, we do have some organizations that are working on that in their community. And it's very important to know with how many people that are affected by this disease, it is an issue for everyone. And a lot of people say, well, not my kid, not my family, but that's what you say until it happens to your kid or to your family. So one of the things we were able to do recently, and with the help of the prosecutor's office, we set up a meeting with the Department of Public Safety. And beginning in May, we're going to be speaking and talking about addiction as a disease and presenting to all of the Police Academy cadets in Atlantic County, as well as their in-service days. We were invited to be able to go out and speak to the in-service about addiction as a disease. And you can understand the frustration of a police officer when they're called to the same house 5, 6, 7 times, and they know what's about to happen. And they know they're going to this house to give naloxone to someone, and then that person, because they are suffering a disease, they do not want to seek help. And I know that's something with, you'll hear from Tanya in a few minutes, the peer recovery and that program that's going on. And the police departments are actually asking for help. They actually, one of the things we discussed was having a hotline, somebody they can call, so when they do show up to a family, they can have that family, if the family member, if the person who has just been using, had naloxone used on them, if they can actually then contact one of these peer supports to come out to the house and work with them to get into treatment. We know that if a person is given naloxone, they can refuse medical treatment. They do not have to go to the hospital. And if a family member is given naloxone, that's a whole group of individuals that we're not even realizing when we have our statistics and give our data of how many people have this addiction. So we're really targeting a lot of different areas. And I think it's really important to know that there is a lot of stuff going on. Unfortunately, just talking about all the different pieces to this puzzle, as Assemblyman Mazzio was saying, it's just this epidemic. And we knew years ago that there was an issue, but having the funding and targeting it, it's a big issue. And so working on different things and bringing the community groups together, having events like this, I do appreciate all of you have come out, and I know there's a lot of Stockton students in this audience, because really it's an epidemic that's facing all of us, and we really need to constantly come together and work on different outlets and work on that information getting out there. And one other thing I'll just mention, and this is something in Atlantic County, if you're not aware of it, and we have such a big issue with the lack of adolescent treatment centers. There is not an adolescent treatment center in Atlantic County. We do not even have outpatient services. There's the Atlantic County Try It program, which will address teens for a very early intervention of marijuana and alcohol. But if you're a school or if you're a juvenile officer who has youth with a marijuana or who's doing this, to send them out of county or to even have outpatient treatment out of county, that's very hard on parents. And that's something we really need to address. Some schools in this county, when they have a person with a violation, a drug and alcohol violation on school campus, they suspend that student for 45 days. The student comes back to school without even having to have any type of intervention or evaluation done. And that's one thing we're trying to address. But if we do address and have these school policies to have these schools have these early interventions, we need some place to send them. And we need to be able to have the enforcement and have these kids have the evaluation before they return to school. So I know when we talk about this heroin issue and with opiates, it really is an epidemic. And it starts, unfortunately, from a young age. And we have to really just address it at all ages and all areas in the community. Thank you.
Thank you. Thank you, Lori. Continuing on the subject of treatment, Alton, what types of barriers occur when someone is seeking treatment, and what can they do to get help?
Well, there's so many actually when you start thinking about barriers associated with treatment. But what we're finding out is that, the first thing we hear is there's not enough treatment beds in the state of New Jersey. What we're finding out where I work at CARES New Jersey, I'm the chief recovery specialist there, is that there are beds available. It's just that you have to navigate the system. So now we're talking about how do we get these parents who are in distress trying to get their child into treatment, how are they going to navigate the system? So the biggest barrier right now is how do they do that? We do that for that individual. We've had 185, 186 individuals come to our center just trying to access treatment since August, and we've been able to navigate treatment 157 times successfully to get those people in. So that's a pretty good success rate of get. And these people are without insurance, a lot of them. Some are on Medicaid, and some is private pay. But you have to find out where those beds are, whether it's through needle exchange, whether it's through a referral through someone else, whether it's through relationships that we've found that we've started to build with treatment centers. Once a month at my facility, I have a breakfast. And at that breakfast, we have people like prosecutor's office, local law enforcement. We have treatment centers come to that breakfast. And what happens is that we're taking people outside of their silos, and we're starting to communicate. So we are learning that there's a lot of treatment beds in the state of New Jersey. And I know that legislation is starting to do a lot of things that's going to open up more treatment beds. But there's a lot of barriers. The first one that we're going to talk a little bit about is that we got to talk about the addict as well. So we're going to talk about commitment, choice, and motivation. Those are the three things that I find out is so important when it comes to barriers, because we can have all the beds in the world. If that addict is not ready to go, unless he's pushed through law enforcement or some other form that's forcing him to go, it doesn't matter. We need to get him motivated. We need to get them to make that right choice and that right commitment. So that's the first barrier we found. I'm actually here tonight. I'm here tonight with a parent that I met a little bit over a year ago. And it was at one of these town halls, and I tend to do a lot of these throughout the state, where we get a chance to talk to individuals. And I love when the families come out, because that's really who we need to hear from. Because one thing that we do know is that addiction is a family disease, and it does not discriminate against anyone. It does not matter your socioeconomic background. It does not matter how big your house is. None of those things matter when it comes down to addiction. So this gentleman that I'm here with tonight, this parent, he called me every name except the child of God that night when we was having this town hall. But why did he do that? He did that because he had a daughter that he had been trying to successfully navigate the system for well over a year. And she was being told to call back in 30 days, call me back every day for 3 months and things like that. So when I sit on this panel and I was talking about we can make a difference in getting your loved one into treatment, he called me a liar and some other things that I can't mention here. And he said that it'll never happen. And all I said to him was, please, just give me a call the next day. We're finding that if you work with these treatment agents, if you work with local law enforcement, if you work with legislation, there's a lot of doors that can open. And I know that there are families here that are probably saying, not my son, not my daughter, we went through that process. You have to. It's very important that you hear this. It's so important to have someone behind you, not just that family member, but someone that has a relationship with these different treatment centers. Just today, I had a young person come into, we launched a mobile outreach center with who? Local law enforcement. Sheriff James Gannon of Morris County, he put up 20 grand of whose money? This is money that they got from drug dealers, that they confiscated from drug dealers. He put $20,000 into a mobile access unit that we can now go out into community where these hotspots are and talk to individuals and navigate treatment for them directly from the unit. It's equipped with Wi-Fi. There's so many different things that we're doing right now that's out of the box stuff, very innovative, that's giving people more access to treatment. The barriers will be there, but I will say this to you. If you guys get with an agency, there's so many different agencies. In every county, there's a municipal alliance. In every town, there's a municipal alliance. Find out who the municipal alliances are. Start volunteering your time. Know the things that's going on around you. It's very important to be empowered about for information of things that's happening around you. And when I talk about that parent, I'm happy to say that we were able to navigate treatment for her. She had called all these treatment agencies, and the same agencies that she called was the same agencies we have partnerships with that we were able to pick up the phone, and she said to me, I just called there yesterday. I called the next day, and there was a bed available for her. But there's something wrong with that picture, which means that that bed was probably available when she called the day before. So we have to change that dynamic of the system as well, but it's going to come down to creating relationships, going out on a limb, and really talking to these treatment centers. I invite them once a month to come to my facility where they can talk to local law enforcement, they talk to local politicians, and we make things happen. There's many barriers, but all of them, I'm going to tell you, can be overcome.
Thank you, Alton, for the excellent advice. Next, joining us on the panel is Tanya Adhern. Tanya is the NCADD New Jersey advocate dedicated to reducing stigma associated with substance misuse and treatment. Tanya, would you tell us how stigma plays a role in this epidemic?
You know, there's been a lot of articles in the paper about people have lost their children from, I mean, people, I give parents a lot of credit for this. People have been coming out and they're going to the press and they're telling their stories about their child being lost to an overdose. You want to see stigma at the finest, is read the comments after the article. And it's amazing, the very hateful comments about someone who just lost their child. It's not looked at as a disease, it is looked at as a choice, and people don't understand it, don't understand why we're putting so much effort into something that somebody has chosen to do. Nobody has to take this medication. But what you don't understand is that there's so many different pieces of this, of treating addiction. There's so many pieces of how the family fits into it. When someone's looking for treatment, we talked about the barriers for getting into treatment. I mean, I have a son who's in recovery that has struggled for 9 years with heroin addiction. He has put us through, I mean, we know everything about the system because we've dealt with the system. But the hardest piece of it, other than, I have to say, mental health is a huge piece. We don't really address mental health enough in our treatment. But the hardest piece of it is after treatment. Once we get through the barrier for getting them into treatment, what happens after? I'd like to see, I mean, I'm a big believer in recovery coaches. We now have, I'm surprised you didn't mention it, that CARES is doing training for peer specialists, which is a state certification now. We have ORP grants throughout the state. Now, actually, every county is going to get an ORP grant, which is an opioid overdose response or recovery program, where if somebody has an overdose in the hospital, they contact a recovery coach, and the recovery coach comes in and works with them to get into treatment. This is huge. But what happens after? I mean, they leave treatment, they come back to the same situation. They don't have the support that they need, and you need a lot of support. Do they need a job? Where do they live? Where's safe housing? I mean, we have very little recovery housing available in the state. It's very expensive. It's not covered by any kind of insurance. So we get somebody into treatment, they come home, and they have nowhere to live, and they don't have a job. How do you stay in recovery when you can't survive? And how do you handle all of it? If you can't cope with life in general, how do you cope with this when you get back and you're not supposed to be using a substance, which is what you used before to cope? So I really believe that the biggest piece of helping people get through the barriers is to have recovery coaches attached to every person that goes through treatment, every person that is also involved in DIFAS, Children's Services, Child Protective Services, because we're putting extra pressure, and also, actually I should say criminal justice as well, because when you put somebody through these kinds of programs, there's a huge amount of stress involved, and they already can't cope. So, I've said this many times to treatment providers across the state. What I'd really love to see is every single person that has been diagnosed with a substance use disorder gets a coach attached to them. And that coach is with them when they're sitting, just like cancer. If you've ever had a family member with cancer, a doctor asks somebody to come in with them when they discuss the treatment options or what they're going to do with treatment. Why aren't we doing that with addiction? I mean, if somebody needs to have somebody there. It's somebody who's addicted, who really is sick and isn't hearing what's going on. Somebody who can hold everyone accountable, someone who can help them through those steps. Someone who's there for them as they get out of treatment and can help them with setting goals, finding jobs, finding housing, trying to just navigate their life, basically. I think this is one of the most important pieces of trying to help somebody help them with their recovery. We're doing, we didn't have the ORP grant in Cape May County, so we started doing a program there voluntarily through actually faith-based organization. And we started it before they even had the ORP grants. So because we don't get funding, it actually worked out to our advantage in some ways because we can run the program how we want it. So we treat anybody, we come in to see anybody that has an addiction. So that could be alcohol, which is 50% of our people that come in are for alcohol. But we go through the whole system with them. We get them to the treatment, but then we follow up with the recovery. And we've had great success. And actually, the best success is when we send them to areas where there's a recovery support community. Unfortunately, we only have Eva's Village up in North Jersey that has a whole community. We've sent them out to places in Pennsylvania because we have no other choice. They have housing, they find them jobs. They have this support from, it's not just 12-step meetings or anything like that, it's actual recovery coaches working with them. And we've put 50 people there. Last year we put 50 people in one community and no one has relapsed. That's huge. It's the support. So we can't put everybody in another state. We can't move everybody in other states. So we need to start working on what we're going to do in our communities. And stigma is an issue, and there's a lot of people who don't believe that they deserve this, but they do deserve this help. And as we start working within the communities, we keep them in our communities, and we make them better there. And actually, I always tease my son because some of the worst traits are some of his best traits. If he learned how to use those traits, if he had somebody coach him and take the things that make us crazy, and use them for good, not evil, they can be extremely successful. If you look at the people that we know that are in recovery, that are doing amazing things, like all the people I work with in NCAT are all in recovery. They speak at the White House. I mean, they're doing amazing things. These are people who at one time were hopeless, and now they're the leaders. So I think that recovery coaches are the way. I think.
Thank you, Tanya. As I mentioned early on, these series, the 17 series of town hall meetings, is really an opportunity to gather information, look at best practices, and also hear from residents in each one of the counties throughout New Jersey. So at this point in time, we're going to open up for questions from the audience. And then some of the things we've heard today was the need for recovery coaches. Obviously, that's something we just heard. The mobile care units, which I think are phenomenal. The need for adolescent center here in Atlantic County, for the role of the legislature, how important that role is in developing solutions. For example, having Narcan available in schools, and certainly the partnership with law enforcement and working hand in hand with prevention and treatment. So we really appreciate the panel's sharing this information with us, and we are going to take these suggestions as we go throughout the state and see how we can make these best practices for the rest of the state. So thank you all. We're going to open up now for questions and comments and suggestions from the audience.
Good afternoon. Okay. My name is Michael McGaffney. I'm a member of Stop the Heroin. I don't know if you guys know what we do, but we scholarship people into sober living after they've gotten treatment. I'm also a member of another organization called Angels in Motion with my friend Susan Howe, and we go on the streets and we talk to substance use disorder people, and we get them basically from the streets into the seats. We are trying to work on resources for these people that are on the streets. We're having problems with funding, number one. One of our resources, state and county funding, when we go and we suggest funding to these people, the funding is running out by this month, May. So they no longer have any funding to get into treatment. We can get them up to Bergen. We give them rides to Bergen if they want to go to detox. But they have problems with simple things like identification. They can't get identification. Assemblyman Mazzio, we've talked about this several times. Prosecutor Tyner, what I would like to find out is if there's any data on overdoses after this funding runs out. Is there any data on the statistics for crime after this funding runs out, and how it can apply maybe to getting more funding, to getting more help for them on the streets? Also, Prosecutor, I'd like to bring to your attention the sentencing for people that go to programs. There are a lot of dealers out there that don't have substance use disorder that are getting in these programs and that are being treated and taking up the place of someone who truly needs the treatment. Is the criteria going to be changed so that someone that is caught and charged with sales and possession is not eligible for these programs, and that incarceration may be? I mean, the bail reform is a big problem. I'm seeing guys getting nailed with 1,000 bags of heroin going back on the street, and 3 weeks later they get nailed with another 900 bags of heroin. You know, how many of those could have been prevented if they were kept incarcerated and if they were dealt with the way they should be dealt with? Another thing is the strict liability law. I understand Ocean County has applied it twice, I think. No? 35 times. Atlantic County?
Well, I can't speak to anything prior to March 15th.
Okay.
However, I do know that we are in the process of building several cases. I will not speak to any one specific case, but there was a recent drug-related death that we've been able to successfully arrest an individual who we know sold that person drugs as well as others. So, as I said, I don't want to fluff it off to anyone else. I can only be prospective and tell you what my office will be doing going forward. We believe that the strict liability law is a very good tool that should be utilized, and we will certainly work with our partners in Ocean and Cumberland and Cape May to ensure that when these drugs are traveling across county lines, that we try to keep a good track of it, and that we pursue folks that are selling bad stuff and contributing to these deaths. You mentioned something else, Mr. McGaffney, that I would like to speak on as well, with respect to dealers taking up spaces that are allocated, you might say, for those people that are using. Once again, don't have any real specific statistics, but I saw this on the bench several times. And the difficulty is that there are many people out there that sell to support their habit. As a result, you know, those people are not, you might say, forbidden from taking advantage of drug court. So what I've seen done in Atlantic County, I mean, they beefed up the criteria when they perform the task evaluations, and they've tried to identify folks that are truly in need. But, you know, it's very difficult because there are folks that sell to support their habit. So in an effort to get anyone who is in need of the program, you know, we've erred on the side of caution, you might say, and we've tried to take everybody in, or as many people as possible. But that is a concern because it is not, drug court in Atlantic County in the state of New Jersey, it is not for folks that are dealing drugs, and it almost makes a mockery of the program. And so I agree with you in that regard.
Thank you.
you. Thank you.
Thank you.
You know, can I just say about the,
Sure.
you were mentioning about the funding. You know, one of the biggest issues we have is that we have a lot of people who can qualify for Medicaid, but because of the IMD exclusion, which is what they call it, they can't, after the age of 20, they can't use inpatient or Medicaid for inpatient treatment. So we might be able to find some place to detox them, and then we can't go any further. So, I mean, one of the things that I think that we should all do, I mean, we should have all learned this year about advocacy. Okay, everybody needs to write to your local or your state senators, congressmen, because we need to fight to get rid of the IMD exclusion, because we could be helping so many more people. There are beds, but there's no funding for those beds. This week is the last time that you can actually go to the, they're doing the budget hearings right now, and you can actually, you know, have you done anything with the budget? Okay. So, and that was one of the big issues, is we need more funding for those beds, because the treatment providers can't survive if they can't pay, you know, if they can't pay for the everyday.
Thank you.
I could just-
Assemblyman.
I was just going to say that the budget is being worked on in April, and our fiscal year starts July to June. So the money that's not there now will be reallocated, and my understanding is there's going to be more for this addiction and heroin epidemic that we're having. So if you want to contact me, we'll see where the numbers are and see where they're allocated to, and hopefully that, you know, we've been advocating, as you know, I've been advocating for more, what we're talking about, sober living and things of that nature, and you need a lot of money for this because it's a big epidemic, you know, you need a lot of resources, and unfortunately, we're not there yet.
Thank you, Assemblyman. I think we have a question in the back.
Yes, hello. My name is Sandra Hanna, and I just wanted to commend all of y'all. I was listening. I worked at very emotional right now, so. I worked at many programs. I will not mention one of them. It was a lot of questions I have asked because it's like a revolving door. And one of the questions I asked at one program that I worked at is, how can so many clients be on methadone for 20 years or over 25 years? Why can't we create a group called Withdrawal from Methadone? So they moved me to somewhere else. So I had to ask a questionnaire because it was inpatient. And what I have asked, it was the young lady in the red shirt, which you mentioned. Yes, we can take care of them here, but when they walk out the door, they have nowhere to go. They have no food. They get back on drugs. So they removed me from the program, period. I listened to every last one of y'all. I came kind of late. I apologize for that. But the thing is, real quick, I am a recovering addict. I was out there for 25 years. I did anything that you could think of right now. Everything. I will have 15 years clean this month.
All right.
I am a sponsor. I sponsor people, and I have a sponsor. But it's so much more that is needed. I am a part of a 12-step meeting, but it's so much more that's needed when it comes to people in treatment, or when they go to treatment, when they come out of treatment. And you know, before I close, just like each corner have a liquor store, just like each drug dealer's on a liquor store, we have to get out there on each corner as well. Or, you know, so question for the young lady in the red shirt: how can I be a coach? Because I would love to be one.
Excellent question.
Yeah, we're actually, that's who you should be asking, really. We're actually putting together some, we have the first, this, in Atlanta County, we're having a program
Yes.
now, I don't know if it's full.
Not yet. We haven't
And you're in
closed it yet.
recovery, if you're in recovery, you can get funding to pay for you to be a recovery coach. So you know, we'll connect. and we'll get you all connected.
I will promise you a scholarship if you want to be a recovery coach. It'll be free of charge.
There
We
they all
won't
are.
charge you anything. I'll promise you a scholarship.
We need people bad. And you
Come
mentioned
down
the-
afterwards and we'll get all your information.
You mentioned the methadone. You know, medication-assisted therapy is an important piece, and it's needed. You know, we have to hit people with every single thing we can hit them with. I mean, we have to try everything. I mean, harm reduction, everything we can, because people are dying at record numbers. It's, you know, whatever we have to do. Years ago, people were on methadone for 20 years. I think that we're working a little bit more with that. We're trying to connect people with mental health disorders and trying to get people to be able to come off of methadone. But again, people need other services like recovery coaches, and I think that's a big part of it, is trying to get people the support they need.
Thank you. Another question, I think, Chris?
Hi, Dorothy Boker. Mr. Mazzio, you mentioned a directive with the first responders that they can't give a second dose without calling a doctor. Is that statewide?
Yes.
Statewide, and you're working on trying to change that?
Yes, we already got it through the committee. We're trying to get it on the floor in the Assembly to vote, and then we take it to the Senate.
Good, because that's crazy.
Thank you for your comments.
Hi, I'm Donna Gaudio. I'm actually from Gloucester County. Just a couple quick comments. Thank you guys for first of all putting this on and for the first one in the state. You were talking about recovery coaches. Gloucester County, actually, we're doing that. I'm a recovery coach going to Kennedy Hospital. We were one of the first ones doing that at Kennedy, and we just really got started, and we're going full force the last couple weekends. Michelle Perez is getting hit left and right with phone calls, so we're going constantly nonstop, and it's just, I can't wait till it gets going with everybody, every hospital. Just when it gets to your hospital and you're part of it, just be prepared to not sleep if you're on call, because it's just amazing how quickly it's taken over. The next question, Lori, you were talking about prevention, and both Dorothy and I don't know if Stephen is still here, we are SACs, student assistance counselors, and I don't know if there's anybody else in the audience. Assemblyman Mazzio, I don't know if you're able to help out at your level, but we are not mandated in schools. Student assistance counselors, we are your forefront of prevention. I know Prosecutor Coronado, you've been at a couple of our conventions, our conferences, and you see how many of us we are, how dedicated we are. And we're not mandated. We've tried for at least 10 years now trying to get student assistance counselors mandated in schools, and I think we've made it as far as the educational committee, possibly one step further. I'm not exactly sure, but I mean, how can we do prevention if we aren't in the school systems? Some districts don't even have a SAC. I know in Gloucester County, Pittman doesn't have a SAC, Kingsway School District doesn't have a SAC, and I know Kingsway just lost a 16-year-old. It's not public knowledge, so I'll leave it at that. But what kind of forum is this? Why are we here? You can put two and two together. So I don't know if there's anything that you can do. I can connect you with our association. We need all the help that we can get. Parents, we've asked parents to write letters. Every 2 years, we're back to the beginning again of writing letters, doing everything that we can to get us mandated. Minimally, one per district. One per school would be ideal, but again, anything that you can do would be of great help. Again, Prosecutor Coronado, thank you for all of your support. We appreciate everything.
Thank you.
Angelo, can I make a comment?
Yes, Lori has a comment about that. You can
First,
go.
I appreciate Donna speaking, because Dorothy, we work with her a lot, and you know, Donna was in our county, and then unfortunately we lost her to another county. But you know, it is important too, because especially when you're looking at a county that does not have treatment for adolescents within it, and a lot of times the SAC being in the high schools is the only person people go to. And besides schools not having a SAC, there's many of our districts where there is a SAC in that district, but they're also the bullying prevention specialist, they're also the guidance counselor, they're also on, you know, they're on, you know, so many different hats. And I actually had one of these, tell me how when a student comes to them, they have to, a SAC, that's actually confidential when a student comes to a SAC in their school. And this person has so many different hats. They actually said that they first have to ask the student, well, is this something that's going to be confidential? Or is this something you're reporting on bullying? Like they had to go through kind of a list of questions before they could determine what aspect they're going to have to help this child. And when you're looking at a county that doesn't have treatment, and then you have schools not even having that SAC certification within that district, it's pretty detrimental to our students.
Thank you, Lori. We have a question in the back.
Yes, hello. My name's Regina Curry, and I'm a senior nurse clinician for Unite Here Health in Atlantic City. We have a health center for the Local 54 and other unions in Atlantic County. We're starting an opioid safety program that's going to start probably June, July, coming together. And we just had a meeting, a pre-meeting, to get together what kind of modalities we need for alternative therapies. We're looking to get a therapist in the health center to help us with this. But when I was talking with my pharmacist, we have 3 clinical pharmacists, and we were talking about the program that Governor Christie was presenting. And I may have been missing something, but I think that the pharmacies have been left out of that program, because according to them, if they were to receive a prescription for an opioid, they would have to fill it if it was signed by a doctor, regardless of the quantity, unless they went on the state website and there was some red flags for abuse. But with a new prescription, they would be obligated to fill it. So I didn't, from what they were telling me, the pharmacist, that there was no teeth for the back end of doctors that maybe were, not going along with the program. And what is the connection with the pharmacies and the doctors?
You have an answer for that? Oh, okay. We could certainly look into that specifically. I'm not sure what specifically the legislation speaks to with regard to the pharmacists. I do know that the prescription monitoring program is evaluated by the Office of the Attorney General, and they do look at the prescribing habits of doctors to see if they're consistent with the laws, and if they're not, they will look into them a little further to see why. So I'm sure that now that the new 5-day limit is in place, if there is a pattern that exists with a physician, a dentist, a nurse practitioner who's prescribing more than a 5-day pattern, a 5-day supply, I'm sure that's going to be a red flag that will be part of the prescription monitoring program evaluation. So, but I will certainly look into that, and if you leave your name, we can, speak a little bit later as well. Yes.
Yeah, and I think that you touched on a good point, that the pharmacist should be in on this, prescribing too much or whoever. There should be a red flag, as the doctor said there. That it's about all parts, everybody working together. And I've been in Trenton for 4 years now, and I've seen a lot of bills that they push out there, and they need to be tweaked or worked on. So what I'm going to do, my legislative aides right here, I'm going to have them look up that bill and see what's going on with that. But thank you for bringing that to our attention.
Thank you very much.
I'll weigh in on that as well, to show you how attitudes are different in different parts of the country. My daughter is away at college in Washington, D.C. She had to go to the emergency room. She had gotten injured, and she needs some tests and everything. So ultimately, the emergency room doctor prescribed her 10 days at twice a day of Percocet, an 18-year-old, for it wasn't a minor situation, but it didn't warrant that. Fortunately enough, she told us what the script was, but in addition to that, surprisingly to me, she got it filled at the CVS down there. Our local CVS actually called us and followed up. The pharmacist personally called us and inquired as to whether or not that was legitimate. And I thought that was pretty interesting. So while legislatively something might not be happening right now, it appears that on some level people have common sense as to what should be happening. And we need to bring that approach to legislation, as Assemblyman Mazzio just indicated that he would look into, because I don't think that's happening on the norm.
And
Thank you.
I think two things are changing a little bit. I mean, a year ago or a couple years ago, I had surgery and I got a prescription for an opiate, and it was 30. It was 30. I didn't need 30. I was afraid not to take any because I didn't know what was going to happen when I went home. But they wouldn't let me just take 5 of them. I
Right.
could not take I could not just fill 5 of the prescription. I had to do all 30. When I have a child that struggles with substance use disorder, the last thing I want to do is bring 30 opiates into my house, because they can sniff them out like you wouldn't believe. I mean, no matter where I put them, they're going to find them. If I've lost them, I should ask. Just like I say, I can't find the key to the safe. Oh, I'll open it. It's crazy. I'm hoping that that's changing.
Question right here.
I'm Kevin Kuzian. I'm a cybersecurity professional here at Stockton, and I was wondering, from the law enforcement perspective, what's being done to prevent the sale and proliferation of opioids on the internet, on dark markets and deep web and stuff like that? Because we can talk about it being sold on the streets, but if someone can just go online and they don't have to leave their home to purchase large quantities of pills.
Especially fentanyl.
That's a very good question. When I got sworn in, it was almost like I was getting the keys or the codes to nuclear codes here, what's going on. I sought out a variety of people, such as Prosecutor Coronado and others to talk to. I was surprised, quite frankly, about the level that the DEA and the FBI are actually trolling on those sites and actually making cases. I know here locally in Atlantic County, there was a case made recently as a result of something that was picked up that was being mailed, and that's a whole different environment. And I would invite anyone else, if Prosecutor Coronado has some experience with investigations on that level, or anyone else. But I do know that at least what I've been briefed on, that both the FBI and DEA are active on those sites.
Yes. Thank you for your question.
Hi, I'm Sarah Fanning. I'm a psychology student here at Stockton University. I have a question about DCPNP's involvement in all these cases, because in the little video you showed in the beginning, some of the parents were discussing that they were afraid to actually contact law enforcement because they feared that DCPNP would come in and take away their children in custody. So what would they do in this situation where one of their children was abusing and they didn't contact anyone, they let their child continue to abuse? Would they lose custody or something like that?
Well, that's interesting hypothetical, because most of the time when we're looking at DCPNP, they're investigating the abuse and neglect of a child as a result of the parent's abuse of or misuse of drugs. So you're asking a question that involves a parent's failure to act on a child that is abusing drugs. And that I believe that the obligation would be the same if it's neglect. If you are not properly giving your child the services that they need, the medical attention that they might need, it falls into if your child has certain medical needs or needs certain medical attention, and you withdraw or withhold that medical attention from them, that is considered neglect under Title IX in the state of New Jersey. So that is something that would be prosecuted. But I can't say that I've seen any instances of that type of situation. More often than not, the facts surround parents who are abusing drugs or alcohol, and as a result of their abuse of those substances, they are unable to provide the appropriate level of care for their children.
I have to say something as a parent. And as a parent who had a child who struggled from when he was 15 or 16 years old, it is call to get your child to go to treatment, to get help. First of all, it's hard to figure out if there's really what's going on. No matter what you hear about, the signs and everything, you go through these stages where and it's natural, the denial and the fear and the anger, the whole thing. But honestly, that if your child at 14 years old says, I'm not going to treatment, there's nothing you can do about it. So, if it's not a matter of, parents are traumatized. I have to tell you, it is traumatizing parents. I have post-traumatic stress. I guess I'm not technically diagnosed, but I'm telling you I have post-traumatic stress. From the things that I've gone through, the things that I've seen. Parents are going through things. I have seen my son overdose several times. I watched my son being brought back to life. This is not something, you don't purposely not help your child. It is just really hard to get them the help and to get them to commit to the help or to admit that they have help. So, I think we spend a lot of times blaming parents. We are constantly labeling it, and anyone who knows me will know that we would just wipe out that word enabling right off out of the dictionary. I don't like the word. We are parents who have not been taught how to deal with something. This is a serious issue that we have no idea how to handle. We're not prepared. So all we can do is educate, and I think, saying that we're going to remove a child from a house because you're not getting a medical care when you can't get them into care is hard. Right. And having siblings, I've had a situation where I've got younger siblings in the house where I've got a child who won't stop using. And, it's not that we allow it, but you try to stop it. You're not allowed to do drugs in our house. Sure. They have them up in the, they got them in the heater vents. They got them everywhere. I just heard a story from a guy where they had holes on the top of the doors and they were stuffing heroin in the top of the doors. How do you stop that? It's hard.
Tanya, I just want to add one thing. Could you just also share the importance of recovery coaches for families as well? Because that's another area.
Well, I'm also a parent coach. I got a lot of hats. I work with the Partnership for Drug-Free Kids as a parent coach in using the CRAFT program, which is the Community Reinforcement and Family Training. We need to work with the parents because they're uneducated. And I remember the first time I found a group called Parent to Parent that I worked with a long time. When I found them, that's the first time I had someone to talk to that understood what it was like as a parent. I probably cried for 2 hours on the phone with them because it's such a relief to find somebody that could give you some support. It's really important. We are the most important tool in recovery for somebody. We have to be educated so that we can help our child in recovery.
Thank you.
Angela, if I can just remark real quick too. Tanya brought a very good point in the state of New Jersey, and this is something for legislation. The fact that at the age of 14, they can refuse treatment. You're talking about an adolescent brain that's not fully developed until the early 20s, and an adolescent brain who is using drugs, okay, whether it's alcohol, marijuana, heroin, and you're saying that they have the right to refuse to go into treatment at the age of 14. That's insane if you think about it. And I think, too, that's just taking the power away from the parents and putting it in the hands of a 14-year-old who is under the influence. And there are states like Florida that have the Marchman Act where a family member, because they are injuring themselves, they can actually have a family member and go to court and have that family go into treatment just like we would for mental health, for, if they're harm and danger to themselves. So I think that's something that really needs to be addressed. And then going back to, we have to have the treatment beds for the adolescents.
Right,
Thank you, Lori.
And also, the siblings are affected, and nobody thinks about the siblings. The siblings have a lot of issues, and my children won't go to treatment. They all need treatment. They all have the post-traumatic stress too. None of them will go, and because they're over 14, or they're 14 over, they can't force them.
Thank you. Before we get to our next question, I have two housekeeping notes. First is you have a participation evaluation. If you can all sign it and fill it out when you leave at the conclusion. And also, when you leave, we have a deactivation kit, which you can use to safely dispose of your unused, unwanted, and expired drugs at home. So this is for everyone who's leaving today as well. Go ahead.
My name is Brendan Foley. I work at a local agency that treats for mental health and addiction. I just wanted to go back to what we were discussing a few questions ago about prescription drugs. And, I just find that it's very interesting from my experiences at my agency that we have an affiliation with the university that students through the rotations at our agency for exposure to mental health and addictions. And all of their experiences they share with us that when they come to our site, out of 10 rotations, we're the only exposure they get to addictions or substance use of any nature. So, historically, the mental health field and addictions field were kind of on opposite ends of the spectrum, and it seems like we're getting a little more integrated over time. I think it's just a little more important, in my opinion, for the medical field to kind of get on board because, especially doctors that, I know we're sharing different viewpoints here, doctors writing prescriptions that they might not know the addictive nature of the medications or, the risk that they may be putting people at. So I think, just speaking on that and, I think the education part, it's much more, there's much more that goes into writing the prescriptions than doctors may know about the addictive nature. So just wanted to note on that and see if you guys had any opinions. I know you also mentioned, I actually didn't know about the minors that are prescribed the addictive medications, that at least the conversation has to be had about the alternatives. Is that new legislation?
That's part of the new legislation that was just recently signed.
Okay.
And also part of that legislation is to require any prescriber, a doctor's, dentist, or nurse practitioner who prescribe opiates, they are mandated to take at least 1 hour of a continuing medical education credit each year on safe prescribing and on opiate in particular, which is specific to New Jersey. Both those laws are specific and only in New Jersey. So the New Jersey legislature have really taken great steps to be able to address the issues that you're describing. Also, the Partnership for a Drug-Free New Jersey, in partnerships with our community partners, have held a series called Do No Harm, which is a series for physicians and prescribers, dentists, and nurse practitioners. And we've had about 3,000 prescribers attend one of these events over the last 2.5 years. And I'll share with you what's most remarkable is that of the individuals attending the events, 90% of them, and this is across the board in every region of the state, indicated the information they learned as a result of attending the event is going to help them change their prescribing habits. So we know it works, and we know you're absolutely right that we have to educate everyone, including the physicians and dentists and nurse practitioners about what they're prescribing and how important it is to share that information with their patients. So thank you.
Thank you.
Simply, what I'd like to see that we could add to that bill is that anyone who prescribes an opiate also prescribes Narcan.
Yes.
Because it's not, people have this misconception that people that overdose are all using heroin. There's a lot of people who are, using legal prescriptions who accidentally overdose. And anyone who has it should have Narcan as well.
That's an excellent recommendation. In fact, that was one of the conversations that was held at our recent Do No Harm. Coming from the medical community, they are starting to take that up as a practice as well. So it's exactly what they were speaking of.
Okay.
Yes.
This is about the recovery coaches. Are they in the hospitals at all times now?
They're called to the hospitals when there's an overdose. I think eventually the hospitals
I just
will
have
be
I
hiring.
had a bad experience at the hospital with my daughter. My husband and I brought her into the hospital. She was detoxing. We couldn't get her into a detox place at that time. We called all the way up to New York and nobody had a bed. They probably do now if I would have called you. But we took her to the hospital and we sat in the waiting room for 4 to 5 hours. We got her in to see a doctor and they treated us like shit and showed us the door. They did nothing for her. A year later, we got her, she was high using and we got her and
I've actually asked the medical director for the state to come up with some kind of protocol for somebody who's detoxing when they come into a hospital.
She was out on the streets again in Atlantic City, and we got her to agree to meet us at the hospital because we knew she was sick. We didn't know how sick she was. We knew she was using. I actually called my friend who is a doctor to meet us at the hospital. I said, because we need to talk these people into admitting my daughter because they won't admit her and she has insurance. unless there's like something wrong with her besides the drugs. So we got her to the hospital, and she had endocarditis in her heart from a dirty needle. And of course, they put her in ICU for 8 days, and her bill was over $500,000 that my insurance paid for.
Instead of
My daughter was in 12 rehabs, and every 30 days, it was like, she has to leave. She can come back in 60 days, and they might pay for another 30 days. My daughter died September 24th, 2015, because we could not work, the system would not help us. So my daughter was born and raised in Galloway. I spoke at Vince Mazzio's forum 2 days after she died. And I'll keep speaking because I'm in recovery. I'm a parent in recovery trying to live without my daughter, who got addicted to opioids from an injury.
Who's accountable?
I don't know.
That's my question, is who's accountable
Well,
when they don't treat?
One thing we're learning is that the hospital profession has not caught up with us yet. They don't have the compassion that we have as of yet, but we're working on that. And when I hear stories such as this one, they're so heartbreaking. And I wish I would have known you then, because we've had that process of having to go in and get that kid.
I've talked to so many people on her addiction. I couldn't get help hardly anywhere. She was on probation. Her probation officer came to my house, and I asked the probation officer, could you please try to get her into drug court? Let's try something different. This isn't working. And her probation officer told me that she's not bad enough to get into drug court. Like, what does she have to do to get into drug court? Like, that was and that's not your fault.
I'm shaking my head because I know specifically that the attitudes toward drug court have changed dramatically within the past year. Yes. Judge Sanson is the head of drug court, presiding over drug court now. Yeah, he wasn't, at that time in 15, he wasn't the drug court judge, but now he is. He has taken a radical approach to it, and I don't think, fortunately for folks in the future, they will not experience what you've experienced. Judge Sanson has been very open about it, but he is a survivor parent as well.
Judge Sanson would have helped you.
Yeah, but I'm listening to her story, though, and it's more than just drug court. She's talking about a whole systemic failure of even going to the hospital. And not even being able to get the help there where you so expect to get the help.
Right.
Absolutely.
People would tell me, like, you can't give her, you got to take her phone away. Well, guess what? We didn't take her phone away. We took her car away because we didn't want her to kill somebody. But her phone, if she didn't have her phone,
You couldn't contact her.
she would never call us that day. We would never gotten her to a hospital, and I would have gotten that phone call that she was dead in a hotel in Atlantic City. We got her to the hospital, and we had 8 days with her, and we got to say goodbye to her, and we got to die with her. Whatever. It's like parents, people who don't go through it should not say anything. They need to be educated. This place should be packed with
Yes.
parents because they think it's not going to happen to them.
Or
I never
they're
thought
afraid.
it was going to happen to me.
Parents are afraid to come out and speak in open, unfortunately.
Sorry for your loss, and thank you for helping to share with us your experience. I'm sure it's going to help other people that are here and people that are going to be hearing about this throughout the state. So thank you. I think we have a question in the
Yes,
back.
my name is Steve Young. I'm with the Atlantic City Peacekeepers. In Atlantic City, we had the Narcan training, and it's very important. As we walk the streets, we're trained in CPR, first aid, the proper way of handling people, conflict resolution, CERT, and we just had our Narcan training. And it's very important because we interact with the people that you're talking about, especially in Atlantic City. And this is a situation in Atlantic City that's so bad with supply and demand. And I mean, there's so many young people that's incarcerated from heroin, so many bags of heroin, but yet they're trying to get a job. So it's the jail, it's the system that we need to talk about fixing. But the major thing is, I have to sympathize with what happened to her, happened to a young man that I know in Atlantic City, about 35 years old. He wanted some help. He came to us, and we went to the hospital. We couldn't get him no help. He said he's going to hurt himself or hurt somebody else, but he needs to get off the street. So we tried and couldn't find nowhere. There was no beds. We were just turned around everywhere we went. I even talked to a lot of ministers to see if they can find some type of rehab or someplace where he can go. So the bottom line, what happened was he didn't get no help until he got incarcerated. And that is a very dangerous situation to our communities. When someone feel like hurting themselves or hurting somebody else in order to go to jail, there's a serious problem with our system. So I just want to say, this education needs to be more of that. These public service announcements on these televisions that we have, we need to have more of this on there. And I know a lot of people don't want to hear this, but it affects the black community just as well, especially when it comes to supply and demand. And most of the black community is incarcerated and selling these drugs to try to make a living, but they don't understand the hurt that it's doing to our communities. So, we want to continue to help, and I think the law needs to be strengthened, but we need to get the information out that there is a place to go without the red tape. Thank you.
Thank you.
The other part of that is, so he finally ends up getting incarcerated. Now he's got a record.
Yes.
Now let's see how you try to find a job when you have a felony record. So that is some of the legislation that's happened. Like we've already done legislation for drug court that if you complete drug court, your record is automatically expunged. I mean, I guess there's some items that
And
they
the
won't do.
Assemblyman and I was just talking. Incarceration costs more than treatment. What's wrong with that picture?
There also, the governor is looking at doing an expungement for other people who have not just drug court. So, I mean, there is some hope for that because if you can't find a job, how are you going to stop using? What are you going to do to survive?
I think we have a question in the center here.
I know. Hi, my name is Christine Miller. I work with the Mental Health Association of New Jersey. We have the New Jersey Connect hotline. And I'm the director of family services for our Atlantic County Mental Health Association. I've been working with a lot of families, and when you say PTSD, I was just raising my hand because I see so many families. The ripple effect of addiction is just unbelievable. And my question is more of a legal question. With 20 years of experience in the mental health field and working with families, there's a point where you put your hands up in the air. And my point is there has been a trend of family members that cannot get their ill family member treatment. They have tried every door and they can't do it. So what they are doing now is buying the drugs for their ill family member, and so that they can see them take it, that they're getting it from a good place, and that they don't see them go through the withdrawal process. And I'm finding out about this, of course, later on, but how do we address these issues? These parents are just grasping at straws. And the choice that they have is to go buy this drug with them and watch them do it, or send them to a hotel room in Atlantic City where they can't see them and can't look at it. What can I tell these families of the legal ramifications of what they're doing to try and get them not to do this?
Well, what about coaches?
Absolutely.
I mean, coaches we're trained in motivational interviewing. I mean, that's really your best bet is to get somebody to work with them, to try to motivate them to want to get some help in some way, or to find some legal way for harm reduction, whether it's going to Suboxone or something to keep them safe, but keep the family out of the legal situation.
The mobile team, where is that? Is that Atlantic County?
Well, the mobile team that we have is only in Morris County right now. We hope to expand to other counties. But when I listen to everyone talk, we have a responsibility as well to do stuff in the community. We put a lot of pressure on law enforcement. We put a lot of pressure on the prosecutors. We put a lot of pressure on legislation. But we have to also come together as a community and do our part as well. It's very important that we educate each other. Look, we go out and we do Narcan trainings for family members. It's just not a Narcan training. It's how to respond to an overdose. But within that training, there's so many different components when we're talking to these individuals. And those kind of scenarios may come up where we can have that discussion. But when I look at, there's many prosecutors that are very proactive. Prosecutor Coronado, he's very proactive in his approach at how he handled this whole epidemic. And I'm hoping that Atlantic County and all the other counties can follow his lead. So there's a lot of things that's being done right now, with recovery coaching, or whether you want to call them certified peer recovery specialists. We do have a curriculum now that's recognized through the Certification Board of the State of New Jersey. CARES New Jersey at this moment right now is the only trainers of that curriculum. But I will tell you that with that, now I got to do full disclosure. I'm in recovery. See, 4 years ago, I was sentenced to 9 years in prison, and I'm working with the same individuals that said I was a menace to society, that I did not deserve to be in the community anymore. So these things can turn around. They can change. Listen, there's going to be some people lost in this fight, and it's sad to hear your particular story, because I'm sitting here and I'm saying that I know as a peer recovery specialist that I could have helped your daughter. I know that I could have gotten her in treatment, and I know we could have gotten the appropriate place to be. That hurts me to hear that. However, the bigger picture is that we as a community has to come together and do everything in our power. We can't leave it up now just to law enforcement legislation. We have to, as a community, take responsibility for our own communities now. It's very important that we do that. We sit back and say, when are they going to pass a law that's going to make this different? No, when are we going to do something within our community? I personally went to the treatment centers. I started walking into detoxes. Detoxes started telling me that, well, yeah, we have 21 beds and we only normally have 7 people. Then why did my person call here? And I know you have that. You told me that you didn't. So what we did, we took these people out of their silos. We started inviting them to our center. And when they started coming to our center, this law enforcement started talking to treatment. Treatment started talking to community. Community started talking to other people. So now we had not people working in silos anymore. We are all in the same room once a month, and we're talking about everything that we're talking about here, and we're coming up with solutions. That's how it's working. When I could pick up the phone and I could call treatment and say, I need a bed, and I know you have one. So now when I call, they have a face to a voice. Now they have a name. So they call and they be like, that's Alton, and he's not going away. That's the difference. We have to be proactive, like Prosecutor Coronado is, very proactive. I've seen some of the things he do, and I'm amazed at it. We have a sheriff, James Gannon. He's very new. He's been our sheriff now for maybe 80-plus days. $20,000 that we got drug confiscated funds that he put in a mobile access unit for us to ride around town 2 days a week, 9 to 2 o'clock, to go out there and talk to these individuals and try to navigate the system. And when I hear you talk, that's really what you're talking about, is how do we navigate the system when everywhere around us look like no one really cares but us. So as she said, find out who's in your community, find out who the recovery coaches are, find out who the certified peer recovery specialists are, find out your municipal alliance, start volunteering your time doing stuff. It's okay to sit back, watch TV, and hear all the great things. We have that NJ Reach number, that everyone calls, that 844. Guess what? I'm getting those too. I'm getting people to say, because now what they're starting to do is warm handoffs, where they're giving a handoff to people. So people are now calling me and saying, we called the 1-844 number that Christy's on TV, and they said to call you guys. It doesn't matter. If they call and I'm able to access treatment and get their son or daughter or loved one in the treatment, who cares the avenue that we got them there? We will get them there. And we will work, I will tell you this, although we're in Morris County, if we receive a call from someone, although we may not get paid for it because our funding is Morris County funding, I help anybody. This man will tell you here that everyone I talk to, I give them my personal cell phone number. That's part of what I do as a certified peer recovery specialist, because I have compassion for it. I have lived experience. So when people come and talk to us, we eliminate a whole bunch of barriers immediately, because I tell them from the door, anything you tell me will have no shock value, because I've done it all. So that takes that away from them. And then we start talking about, how can I make your life better today? And it does not start with, I want to go to treatment. It starts with, I have no housing, I have no food, and the only clothes I have is what I'm wearing. So let me take what we call Maslow's hierarchy of need. Let me take those things away from those individuals, those particular worries, and then they may start thinking about going to treatment. That's what we do, eliminate barriers. We talk about a thing called sustainable recovery. Everyone can get clean for a little bit. I don't care who you are, but how do you sustain that? And the way you sustain it is removing those barriers. And I know Ms. Aaron could talk about this as well. We eliminate those barriers to housing, employment, everyday needs that we have. That's what we do. But it's gonna take all of you guys, a community, to make this thing work. We have to, as a community, be proactive.
There are, and actually, the faith-based communities have really stepped up. I mean, in Cape May County, because I can only speak really of Cape May County, but Cape May County Lighthouse Church put together a whole program. That's who does the hospital program there. It's all voluntary. They go out on the streets, they talk to people, they have classes every Thursday for all different kinds of classes. Everything's done for free. I mean, they have stepped up, and we have another church on Ocean Heights Avenue. I can't think of the name right now.
Fusion. Fusion.
Yep, and
Fresh start.
We've got churches popping up that are trying to help people, and I think we need to, that's part of it. That's it. I think that we're starting to see the communities are starting to step up because somebody has to help. I mean, you have to help everybody's got to do it.
That's right.
We got to do it or no one's going to do it.
And I applaud you guys for what you guys are doing.
Thank you for both those comments. I just want to add that the recovery coaches are individuals who have been through
Lived experience.
treatment and are in recoveries.
Well,
Not necessarily treatment.
Family affected, somebody affected.
Absolutely.
About how many,
Hi,
excuse me for 1 second, I just want to follow up on the recovery coaches. About how many, in your experience, people do you service at any one time?
So let me just I could give you some numbers of people that came to our center. Let's just say last year we had over 3,800 people come through the center. Myself personally, since August of last year, I've navigated treatment for about 160 plus individuals. I've had about 180 plus come through and say, I want to go to treatment, because that's our conversation. It's client initiated. They're going to come in. They're going to tell me what they want and what's going to be more successful for them. That's the difference with, even when you talk about sponsor and sponsee, you have this shift differential, or power differential. And when you talk about client and clinician, you have that same differential. So you already go in as an addict, feeling a little bit defeated, your self-esteem is kind of low, and then you have that shift, that power differential. It kind of hurts you a little bit more. When you walk into our center, which we also do have a center that's a safe place for people to come, that's open 5 days a week from 9 to 4:30. They can come, and they tell me they need to stay longer. I'll come from my house, open the center, and say, let's party. That's just what we do. But we eliminate that power differential. It's here. It's peer-to-peer, where they're going to come in and say, this is what I need, and this is what I'm willing to do. And I'm going to say, well, I'm going to eliminate whatever barriers are associated with you getting there. It's a real simple process, but it works because it's peer-to-peer. It's not this. We don't look down on anybody. It's like this. It works. We have a 73% success rate of the people that we send to treatment. So why is that? Because we have a three-pronged approach to our program. It's pre, it's during, and post. I don't send anyone to a treatment program, one, that I haven't visited myself. I haven't talked to John will tell you, that I haven't talked to every clinician in the facility. I send them with a release of information form, because I also work in a treatment center as well. I send them with a release of information form that when they go to that treatment center, I can coordinate services with that treatment team. And guess what happens when it comes down to discharge? They're not just going to walk out your door. That treatment center has to call me, and we're going to talk about where they're going to go for discharge, continuum of care. And a lot of that is referred right back to us, where we're going to work on what Ms. Ahern talked about, life stuff, employment. Those are the things. That's the reason why we got high again. We came home, we was unemployed. Probably a lot of us was unemployable because we hadn't worked in 10, 15 years. So we had to relearn all these skills all over. That's what we do at the center. We work with these individuals. We take their hand and we walk with them along this journey that they're going on. That's what makes it so successful. 73% success rate. There's so many different things out there available for people. AA and NA work for me. It may not work for the next person. So we recognize that's not the only show in town. There's many different ways to skin a cat. You ever heard that saying?
Yes,
I'm from North Carolina, so that kind of works for me. But there's so many different things we can do, and all we ask you guys is give us a call. I don't care where you are. We will coordinate services for you. We talk to everyone throughout the state. And yes, is legislation important? Absolutely. Is law enforcement important? Absolutely. But is community as important? Absolutely, as all of those people.
Well, and he makes a good point. CARES is a community recovery,
Yes.
it's a community center, basically. which is it's really big to have some place where people can go and feel comfortable and walk in and get that support. We used to have Hope All Day, which ended up, there was no funding and they really couldn't survive, but it's really important. I think that's what the churches are doing. A lot of the churches are stepping up and letting them come in as a community center almost. Also, you know, I mean, we're talking about a lot of young people who've been involved in addiction since they were very young. They don't have the normal life skills. You know, I remember I was in the Ocean County Task Force meeting and there was a doctor in there, we were talking about this, and he said, you know, some people don't even know how to make toast.
How about it?
You know, we don't even think about that. And when they go to probation, there's like, you do this, 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 and this, but they've never done any of these things. They don't know how to make a phone call. They don't know how to do any of that. They need a coach.
I think the Assemblyman has a comment as well.
Yeah, I just, since we're asking questions here, the mindset of the addict, right? As far as, I've talked to a lot of parents, and there is a point where the addict wants treatment. They want to reach out and they want help. And what's that time frame? I mean, how do you address that?
I'm going to say, I don't know if you call it time frame, but you'll hear me say a lot, and John will tell you this. I call those defining moments. And I think every addict has a defining moment when he's ready. And guess what? When he's ready, they're ready right then. That moment.
Well, maybe just
Listen,
have this,
that's your experience, and what I'm going to say to you but wait a minute, let me finish. There are places.
I took my son to the emergency room in Atlantic City, and they said, we're sorry, but there's nothing we can do for you.
Well, what I will say is that I've had that same conversation with many parents who have left out of the hospital, many parents who have called treatment centers that will then call us, and we find. But I'm saying, it's not a special club.
What we need to know is, what do we do now? What do we do now? The parents, these people that are going home, their children are on heroin or doing opiates, or their neighbors or their nieces and nephews. What do they do tonight?
As I said to you, as I said before, is that you find your local organization that are really doing stuff. Okay, people looked out.
Local organization, and I can't tell these people when they call me at 2 o'clock in the morning. I don't know what to tell them because there is no place here in Atlantic County that we can take them.
And I will say this to you, I had that same conversation a year ago. We didn't have these connections, but as I said to you, as a local organization, this is what I did. I was very proactive. I went to the treatment centers. I called every day. I got letters. I went there. We talked to clinicians. We talked to the treatment team. We got them to start coming to our community. As I said before, we cannot work in silos anymore. Your organization, now you have to branch yourself out, and that's what we had to do. We had to branch ourselves out, and we became a part of the entire community, not just from a recovery or an addiction standpoint, but we started this conversation in the community with law enforcement. How do you think the sheriff came to us and said, hey, I want to go mobile, how do I do it? It wasn't because of something that happened right then. It's because we started having these conversations. And I'm not saying that this thing is going to change overnight here in Atlantic County. I'm not saying it's going to change overnight, but it has to start somewhere. If we sit back and continuously say there's nothing available for us here, then let's make something available. Because what I've said is that those same hospitals, St. Clair's, and I mentioned them in Morristown, in Booton, said, look, we have 21 beds, and we normally only had 7 people in the beds. That told me that there was 14 beds that was normally available. So I started hounding the hospital. That's what I started doing. Guess what? They started attending the breakfast. Once they started attending the breakfast, not only did I have hospitals there, but I had families there that had individuals that needed care. His daughter was one of them. When they came to the breakfast, I had his daughter there, and I said to the treatment centers, help her. You know what they said? They sat we sat in couches, and they said to me, wow, we can't help her. We can't do anything for her. And I said, absolutely, somebody has to help her. And guess what? Those same treatment centers that said they couldn't do anything, they got on the phone and started calling their people. They started calling favors in. This is what we have to do. It may not happen overnight, but that's what has to happen. We have to start a conversation with every aspect of individual that can help us. And that's what we did at CARES. That's how we started to grow. We formed relationships. We wasn't worried about who got the most funding. We wasn't worried about did the money go over there and didn't go over there. We didn't worry about who got the next big grant. We didn't worry about anything else. We just said, if you're doing something that's going to help these people, we want you to be a part of what we're doing. Let's coordinate services.
Mr. Allen, let me ask you something from ground one.
Yeah.
who do we contact to start training recovery coaches here in Atlantic County?
You contact us.
Okay.
You contact us.
Okay, very good.
We have
We
a training starting
train.
this week.
Yes, they have training going this week.
Thursday.
Who's doing the training?
Enlightened Solutions.
Enlightened Solutions.
And that's right here
How
in
much-
Atlantic County.
In your experience, how much does it cost to train a recovery coach?
Our scholarship, listen,
But no,
$1,000. It's $1,000.
It's $1,000
For 8
to
weeks.
train for 8 weeks.
Yes.
If you're in recovery,
Okay.
though, there's funding through the state for that.
Oh, wait a minute. Hold on. Hold on.
Oh, there you go.
Hold on. I know that I did hear some issues down in Atlantic County with Division of Vocational Rehabilitation.
And Cape May County.
And Cape May County. So we did hear about that, and we are addressing that with Division of Vocational Rehabilitation, because we went through this long process of making this happen, and then they made it so hard for people to get the funding that's available for them to get.
We have the representative from Atlantic County right here, Bob.
We're going to fix it.
My name is Bob Wittitz. I'm the County Director of Substance Abuse Services, and I just want you to know, in every county, through the local government, there is a coordinator of drug and alcohol services. And I'm glad that we're here in Atlantic County for the kickoff of this, because I'm passionate about what I do, and I may ruffle some feathers with what I have to say. But the thing about it is, you know, we do have money available. The money's available for people who are medically and financially indigent. Every county gets funding every year, and we get that funding through the Chapter 51 AEREF grant. The problem with it is was mentioned a number of times, there's not enough money available. But the gentleman, I'm sorry he left, here in Atlantic County, we actually stretch that money out pretty much into November and December. As he said, most counties run out of money. We're very particular, especially with regard to detox and short-term residential. We insist that they are Atlantic County residents. When all these neighboring counties are running out of money, you'd be surprised at how many people miraculously become Atlantic County residents and are looking for funding. The problem is that particular grant, and I'll turn to my congressman, that particular grant, the funds come from...
I'm not there yet. I'm assembling.
Representative, I am sorry. Those funds come from the bottle tax. Every bit of alcohol that is sold, there is a tax on it. And the bottle tax money goes to the state. Unfortunately, the majority of that money goes into the general fund. There's only about 13% of that money that is actually going back to the counties to address the problem of addiction, whether it be heroin or any other addiction. And there is not enough monies available to help. Most of the people coming through our doors are medically or financially indigent. We also have a grant through the Dieter funds.
Yes.
Okay? The Dieter funds are anyone convicted of a drug crime pay fines. Through that, the Governor's Council on Alcoholism and Drug Abuse. Angelo is a recipient of some of the monies that come through that fund. Again, we have a grant in the state that is now addressing the training of Narcan, all right? The thing is that John Brooks was the local agency that had it. When they made their big move, they chose not to reapply for the grant. It is now run through Urban Treatment in Camden County, but they're doing all 7 southern counties. We get 15 trainings a year with a maximum of 20 people for training. That's 300 people. We took it upon ourselves to try and expand that program. We took it into schools. We have school nurses and school SACs that are being trained. We took it in, not all police departments are trained. We've taken it into some police departments, some fire departments, lifeguards. We tried to expand it. Unfortunately, the money that we were using for that is now putting on temporary hold because the feeling was we were supplanting, you know, the other grant. Hopefully that'll change in the future. The other thing is that we had a recovery center here in Atlantic County. One of very few recovery centers in the whole state of New Jersey, and unique in that it was run strictly by volunteers. We're in jeopardy of losing our recovery center. Our recovery center, which was based originally out of Blue Heron Blue Heron Pines, their second golf course. They lost that lease. The property was turned into another treatment center, and they lost that lease. They moved to Mays Landing. They just recently lost that lease because the property was sold. I mean, if you're looking for places, we need the bottle tax money to be pumped up. It was originally supposed to go to treatment. Only 13% of that money is going to treatment. We need other grants to look at letting people expand things that they think they're, as far as I'm concerned, saving a life is prevention, okay?
Bob, could you talk about the Recovery Coach program in the county? I know there was a comment about getting access to scholarships for that. I know there's some.
Okay, well, we have the Recovery Coach grant, and we have that grant through Atlantic Care Behavioral Health. Now, we just got it last year, but I'm talking about the Recovery Center. We had Hope All Day Recovery Center.
Bob, how many, if you know, how many recovery coaches in the county do we have?
I don't know that. I can't,
Okay.
I honestly
This
can't
is-
answer. The program just started, and it just got kicked off. I think it may have just kicked off this past month. So
And this
there-
is what I say to you, between your office and your resources, my agency and our resources, Assemblyman Mazzio and his resources, by this time next year, because I'm an impatient person, I need 30 recovery coaches here in Atlantic County.
I agree.
I don't know how it gets done, but it gets done.
I'm glad that, I happen to know the prosecutor personally. I know a number of different people who are sitting here on the panel. I was about to reach out to him, as well, to look for other avenues of funding for the Narcan training and things like that, that possibly we can work on. But all I'm trying to say is we are, as a community, working together.
Yes.
But there are stumbling blocks along the way, no matter which way you turn.
That's right.
So we need your help in encouraging people to look at things like increasing the Chapter 51 funding, expanding, the JICATA funding for the Alliances for the Prevention of Alcohol Abuse, and doing whatever we can. And I throw this out there because it's sincerely coming from my heart to help somebody like Hope All Day Recovery Center, which was doing an unbelievable job out there, also guiding people through the system and getting them where they needed to be, finding them a new home so they can stay in Atlantic County. We're in jeopardy right now of losing them to Gloucester County, who is champing at the bit to get them. So
Thank you, Bob. I think we have one more question from one of the students that's up there. No, I think the gentleman here in this row. We'll take both of your questions. Did you have your hands up? Right.
You know, in Ocean County, they do have an organization that's kind of organizing the recovery coaches, kind of like what you're doing with CARES too. And I think that's really important because we can't just have recovery coaches running all over the place and not be able to, like you said, where are the recovery coaches? We need to have an organization like they do in Ocean County where they're all kind of going through there and we know, people know how to get them, right?
What they were mentioning about the grant, Atlantic County did bid on that grant when it was first put out for RFP, and we did not get it. And now they then contacted then again that there was several more up for RFP, and Atlantic Care did just get it. And as of right now, I mean, they're hiring, and whether they're trained, they'll send the person for training. They are in the midst of hiring their recovery coaches as we speak. I mean, it's just kicked off.
Yes, go ahead, sir.
Yeah. The gentleman down there said that there was a grant for the peer recovery specialists. We've been having trouble accessing any of that money. We've sent quite a few people out there to become certified, and they keep getting turned away from DVR. Also, the Dieter fines and things of that nature, a lot of people pay a lot of fines. I don't understand exactly. I heard your answer, but I still don't understand exactly why that money is not going towards getting people treatment. I don't think anybody really answered that question. Because every week I get multiple calls from people, parents crying that they can't get their children into treatment. And I personally almost died trying to get into treatment. And it wasn't but for a scholarship provided to me that I am still alive today and doing what I'm doing. And it's just a very depressing situation that I'm faced with on a daily basis. I mean, that being said, I did manage, to get people, like even last week I got 2 people into state-run facilities, but it's very difficult And those barriers are killing people because, you know, like Alton was saying, when people are ready to go, it takes a lot for an addict to get to a point where they're like, okay, I'm beat, let's go. You know, and I know for myself personally, speaking from personal experience, that doesn't last forever. Because I get the next few in me, and then that's all out the window. Forget it, don't ever be anything. It was stupid to even think I could. You know, because the treatment is not accessible. And I just don't understand with the amount of money that we have and the amount of people paying fines constantly. Every person who gets a drug charge pays a deed or fine.
Yeah.
Why is it even a problem to get people into facilities?
Well, I could address that first. I want to thank you for your comments. Why don't we just take the last gentleman here, and then we can answer both. Do you have a question? Someone in the, yes.
My question pales in comparison to people who have lost loved ones and people who have been through, traumatic experiences themselves. I come from a very small community in northeast New Jersey, Bergen County, and there really isn't much of a spoken about problem. There are people that suffer, there are families that suffer, and they take care of the problems in family. They find a way to get their children or loved ones help, usually out of state, private facilities obviously, but that doesn't apply here. And for those kinds of towns, the town I'm from specifically, there is no awareness of the subject because it's not bleeding through into the school system, because it's not bleeding into to the community, and a lot of people pick it up and a lot of people drop it quickly. But yes, if we could talk to people, there would be a lot less cases coming up. What do you recommend to do? Appropriate way to phrase it. What do you recommend be done for communities that don't have a very obvious problem on the outside, but definitely have one on the inside?
Every community has a problem. There is not one community that does not have a problem. It's funny, I was talking to somebody from my hometown, which is a very well-to-do area in Morris County, and they said to me, we don't have a problem in our school, we don't have anything. Oh, and then talked a little bit later, had a beer. Oh yeah, my son's friend overdosed. I'm like, hello, it's happening everywhere. And I think that it's the stigma, and I think that when we talk about prevention, everyone talks about teaching people about drugs and things, but to me, prevention starts way before that. We start recognizing high-risk children when they're in first grade. I can walk into elementary school and I can show you high-risk children that are really because of the way the schools have gone with the emphasis on all of the state testing and things. There's no time for the schools to really work with some of these kids, and they're slipping through the cracks and they're not being recognized. And before you know it, they get to middle school and you got a problem.
Sure.
And it could have been recognized much earlier, but we're not talking about how those issues, mental health, learning issues, low self-esteem, how they can lead to addiction and what to look like. So we need to start, before we start talking, like pushing everybody in the high schools, we got to talk about the drugs in the high schools. We should be talking early and making it just a normal conversation about wellness. Think Patrick Kennedy talks all the time about, we're always thinking about physical wellness, but the brain is important, and we're not working with the brain. We're not talking about overall wellness in our schools.
Well, we talk about a lot of.
Yes.
Go ahead.
The gentleman up in the top there, I just wanted to clarify that the DEETR funds actually are going to prevention.
Right.
And there's prevention programs done in every county and just about every community in the state. It is the bottle tax money that is going to the treatment side.
No, thank you, Bob. I was going to mention about obviously the need for prevention, certainly treatment and recovery, and a continuation of care. There obviously, as we've seen today from all the speakers, this is a very complicated and complex issue that there's no panacea, no silver bullet that's going to be able to solve. It's going to take everyone in the community to be involved in coming up with solutions. Certainly it's going to take law enforcement and the legislature. It's going to take prevention and treatment. It's going to take parents who have been through this as really breaking down the stigma. It's going to take the medical community to step up and understand their responsibility and their role. And I think that today was a good start on bringing together different disciplines within the community, stakeholders. Most importantly, bringing together people who have been through the experience, who can share those experiences and help to be able to come up with solutions to help other people who are going through those same experiences, as we just heard today and tomorrow and the next day. So I just want to thank each and every one of you for sharing with us today, for joining the conversation, for being part of this discussion. It was extremely informative. I personally have been involved with prevention for the past 26 years, and I've learned things today that I was not aware of. So this is really the reason why we're bringing together these kind of programs, is to learn, because I think ultimately we want to stop an individual from going down that road. And one way to stop it, and we heard today about the path to addiction, it could be a sports injury. It could have been a broken limb that a person received a prescription for, especially a young person, that led that person down the path of addiction. We are working on ways to be able to bring that under control through the legislative process. Now we're the only state in the nation that has a 5-day limit. We're the only state in the nation that has a requirement that doctors become educated on an annual basis on this issue. We're the only state in the nation that requires a prescriber to have a conversation with the parents of a patient 18 and under, or to have a conversation with an adult patient who's receiving an opiate, to talk about what alternatives are available, non-opiate alternatives to deal with acute pain. So we are certainly making progress. It's not fast enough, we understand that, especially for those that are dealing with this on a personal level, and those that are dealing with this immediately. But I think that in the long run, I think as we go forward, we're going to see that the epidemic will be under control, and that we will be seeing the reversal of numbers because of these steps, because of educating people, because of breaking down stigma, and because of events like this. So I want to thank everyone for attending and look forward to continued conversation. Thank you.